Hi, my name is Jennifer Salinas. I'm a physician assistant student at the University of Pittsburgh, and today I'll be demonstrating the simple interrupted suture technique. So for this, I'll need my needle driver, my forceps with teeth, my suture scissors, my suture needle, my wound pad, sharps container, and sterile gloves and sterile drapes. So some indications for this procedure is lacerations deeper than the dermis requiring wound edge approximation, and then wound under tension over the joints to improve healing. Contradictions would be areas where there's high risk of infections or human or animal bites that delay closure or require special management. Some complications from this can be infection of the wound site, scarring, poor cosmetic outcomes, and now I'm going to go ahead and position my camera a little bit lower so we are able to see what I'm doing. So I've already set up my sterile field. I've made sure that the bottom area was cleaned and wiped down appropriately, and then opened my sterile field using that one corner technique. So now I'm going to go ahead and perform hand hygiene and then place my gloves starting with my dominant hand, only using this rim corner of the gloves with my dominant hand, I apologize. And now I'm going to grab my other glove and I'm going to put my non-dominant hand in the glove. Perfect. So now I have my gloves. I'm going to bring my tools that are assumed to be packaged, and now they're open and being placed onto the table along with my needle. I'm going to go ahead and have my patient bring their arm onto the sterile field. I'm going to wipe the area down, and I'm going to place my fenestrated drape on there. Perfect. So now I'm going to go ahead and grab my needle driver, and I'm going to pick up my needle appropriately. So laying it flat, grabbing it 2/3 of the way. I'm going to pull on the tension here, or memory, and I'm going to enter it at a 90-degree angle and about 3 to 5 millimeters from the wound edge through the dermis, and making sure that I have opposite and equal length on each side. So I'm going to go ahead and push that through, grabbing it with this, and then pulling the string through, the sutures through. Perfect. And now I'm going to go ahead and move on to my knots. So I'm going to do 2 knots, 1, 2, grabbing my tail on this side and crossing my hands. And now I'm going to do 1 knot, and I'm putting my needle driver over the wound. Perfect. I'm going to do 1 more. Perfect. Now I'm going to go ahead and cut the excess off. Perfect. And I will repeat that same process. So grabbing my needle with my driver, scooping or biting at a 90-degree angle, making sure that I have equal lengths, pulling it through. Perfect. And now I'm going to do 2 knots and cross my hands. Beautiful. Then 1 more. Crossing again. And cutting them off. Perfect. Now repeating the same process, grabbing my needle driver, going at a 90-degree angle, grabbing my needle from 2/3 of the way, bringing it through, doing 2 loops, doing 1, perfect. Now I'm going to go ahead and cut my ends here. And I will repeat the process one last time. 90-degree angle, bringing it to the other side. And I'm making sure that I'm not pushing the needle through, but instead that it just glides through naturally. And so we'll do 2 loops. 2. Beautiful. Then we'll do 1, putting my needle driver over the wound. Crossing my hands. Do 1. And then 1 more. Perfect. And now we'll cut the tails off here. Awesome. And so now that this has been completed, all of them are on the same side with equal spacing, I will go ahead and make sure that well, I just broke Serofield, but for the sake of this video, I just broke it. I will make sure that I dispose of my needle in the sharps container, put my gloves where they need to, and that really concludes the end of my video. I've also made sure that there are all equal approximated wound edges, and yeah, this completes it. Thank you so much for watching the simple uninterrupted suture technique, and have a great rest of your day.